Hi, hello everyone. Today I will teach you regarding the first unit of social and preventive pharmacy. So, in social and preventive pharmacy, the first thing we have to learn is what is the definition of health. So, what is the definition of health? It is the state of a physical, mental, and social well being. So, many of you think that health means nothing but if a person is not having any disease, then that is health. No, it is wrong. According to World Health Organization, the health means it is the state of physical, mental, and social well-being. If a person is perfect according to his physical status, mental status, and social status, physical status in the sense physical fitness, mental in the sense psychologically fit, and social in the sense if he's having good communication with the environment, then he is called as an healthy individual. So, what are the dimensions of good health? There are different dimensions of good health. The first one, physical dimension. Physical dimension is nothing but maintaining a healthy body by taking healthy diet. And emotional dimension, in the sense, maintaining emotional stability. Spiritual dimension is nothing but understanding the ethics and morals of the life and proceeding according to those ethics and morals. And intellectual dimension in the sense learning and problem solving skills. He has to learn the problem solving skills in his life. That is intellectual balance. And environmental dimension in the sense he's protecting against environmental hazards, protecting his body, protecting his self against some environmental hazards is the environmental dimension. And social dimension in the sense communicating perfectly with the others, communicating perfectly with his family, or communicating perfectly with the other people, that is called as social wellness. So these are the dimensions of maintaining a good health. Next, concepts of health. There are different concepts of health, which includes the first one, biomedical concept. So according to the biomedical concept, as it is a medical concept, if a person is free from disease, then he is called as an healthy person. This concept is biomedical concept. Next, ecological concept. Ecological concept means nothing but maintaining the equilibrium between the man and the environment. If a man maintains a good equilibrium with the environment, then that person is called as an healthy person. So that concept is called as an ecological concept. Next, psychological concept. If a person is fit through his mental state, then that concept is called as psychological concept. Then that person is called as an healthy individual. Next, holistic concept. The holistic concept is nothing but it combines the all three components. That is, if a person is social, economical, political, and environmental fit, then he is called as an healthy individual. So these are the different concepts of health, which includes biomedical, ecological, psychological, and holistic concept. Then next, what is public health? What is public health? See, normal health is health of an individual. Then public health means what? The health of the community. The health of the community is called as public health. If the community is free from diseases, the science and art of preventing a disease in the community and promoting the life of the community and promoting the health of the community is called as public health. There are different public health systems which promotes the public health. There are different health agencies at state and local levels, healthcare providers, public safety agencies, charity organizations, youth development organizations, arts related organizations, economic and philanthropic organizations, and environmental agencies. Like this, there are different types of agencies and organizations which will promote the health of the public through different programs, through different social programs. So these are the organizations and agencies which promotes the health of the people. These all are included in a system which is called as public health system. Next, what are the dimensions of public health? The dimensions of the public health means nothing but maintaining, how to maintain public health. The first thing is preventive medicine. So always you remember the prevention is better than cure. Before any disease occurs to an human body, if he can prevent it, then that will be good. So that is why prevention is always better than cure. How he can prevent it? By modifying his lifestyle, by avoiding the bad habits, he can easily prevent such type of diseases. So that is preventive medicine is one of the dimension of public health. Next one, social medicine. Social medicine means what? Promoting the health of the people socially. Means our government gives some medicine directly to the public for promoting the health. They will provide vitamin tablets. They will provide some minerals like that. They will provide, for example, polio program is there. So they are promoting the health of the children by that polio program. So that comes under social medicine. Next one is community health. Community health is nothing but protecting the health of community through different environmental sanitation programs. Environment also affects the public health. So environmental sanitation is very much necessary. If there is no perfect sanitation of environment, then the public will be affected by different diseases like typhoid, cholera, like that. So the government, what that will do, the government will promote the environmental sanitation by different programs so that the health of the community is improved. Next, community medicine. Community medicine is directly given to the public through different government hospitals like healthcare centers. They will provide direct medicine to the people in their homes. For example, this corona is there. During corona time, the government have provided one kit. That kit is supplied to every home where this corona is affected. So like this, that community medicine is maintained. So these are the dimensions of the public health, which includes preventive medicine, social medicine, community health, and community medicine. Next, concept of a disease. So what is a disease? First of all, the disease is nothing but it is a physiological or psychological disorder of a human being. It may be physiological, means what? The disorder which comes to his body, or the disorder which comes according to his mindset or emotional balance. The imbalance of emotional state of a human being, that is psychological disorder. So like this, the concept of a disease is what? It is simple. It is a physiological or psychological disorder of a human being is called as disease. There are different types of diseases. Mainly you see, we have learned regarding communicable diseases and non-communicable diseases. Communicable diseases means what? The diseases which transfers from one person to another person. Non-communicable diseases means what? The diseases which are not transferred from one person to another person. Like that, there are two types of diseases, communicable and non-communicable. And along with that, there are four types of diseases. There are, first one, infectious diseases, which causes infection to the human beings. Deficiency diseases, these are mainly caused due to the deficiency of diet or deficiency of minerals or deficiency of vitamins. And hereditary diseases in the sense which comes from their forefathers, according to the genes, they will get those diseases. That type of diseases are called as hereditary diseases. Next, physiological diseases are nothing but the organ failures. Whatever the organs and whatever the systems are there in the human being, if they cannot function properly, they will get some diseases. They are called as physiological diseases. So these are the different types of diseases. Next, the levels of prevention of a disease. How to prevent a disease? This is very, very important. How to prevent a disease? First one, the first level of preventing a disease is primordial prevention. Primordial prevention is nothing but before the risk factors are appeared in the population, before the population gets the symptoms of a disease. If the government prevents, if you can prevent, if the individual can prevent a disease, then that type of prevention is called as primordial prevention. Next one is primary prevention. The primary prevention is nothing but the actions which are taken before the onset of a disease. The first one is before the risk factors. The second one is before the onset of a disease. Before a disease occurs to the human being, if he has taken some preventive steps, that comes under primary prevention. Next is secondary prevention. Secondary prevention is nothing but now the disease has occurred in the community. Now we have to stop the progress of the disease. We have to stop the communicable disease. We have to stop the exposure of the disease to the different types of the public. So that is called as secondary prevention. Next one is tertiary prevention. Tertiary prevention is nothing but it is a measure to reduce the sufferings which are caused by the disease. Now the disease has spread to the public. Now we have to reduce the sufferings of the disease. We have to reduce the effects of the disease. That type of prevention is called as tertiary prevention. Next one, quaternary prevention. Quaternary prevention is nothing but avoiding the consequences of a disease, avoiding the deaths of the public because of the disease. That is called as quaternary prevention. These all are the prevention levels, the levels of prevention of a disease. The first one is primordial prevention, which we will take before the risk factors. Next one is primary prevention, which we will take before the onset of a disease. Next, secondary prevention, which we will take for stopping the progress of a disease. And tertiary prevention, which we will take to reduce the sufferings which are caused by a disease. And quaternary prevention is to avoid the consequences of a disease. Next, disease control methods. There are different types of disease control methods. In that, the first one is Health promotion, promoting the health of a people by health education and lifestyle changes. The government will promote the health of a people through different lifestyle changes and health education. If you provide good and perfect health education to the people, they can promote their health very easily. Lifestyle changes in the sense daily walking, daily doing their exercises, physical exercise, and avoiding alcohol, avoiding smoking, like this. These are the lifestyle changes. By these, you can promote your health. Next, specific protection. Specific protection is given by immunization and nutrition. Immunization. There are different types of immunization programs which are given by the government. The government is providing different types of immunization programs, immunity programs, developing immunization. For example, now the corona is there. For corona, we have taken the vaccine. That vaccine is what? It is one of the immunization program. Like that, taking the nutrition for improving the immunity, that is also comes under the immunization program. That is called as specific protection. This is specific protection is one of the disease control method. And early detection and treatment. If any disease is going to occur, treating a disease through early identification, through early diagnosis, you can treat any disease very easily. So that is why early diagnosis is also very important. Next, quarantine and isolation. Already the disease has occurred in the public. Then what we have to do? We have to protect the public by preventing the exposure. Whoever has got the disease, we have to isolate him, we have to quarantine him, so that the disease cannot be transferred from one person to another person. So that is another method of disease control, that is quarantine and isolation. So these are the four different methods of disease control: health promotion, specific protection, early detection and treatment, quarantine and isolation. Next, what are the social causes of a disease? Social causes of a disease. Social causes of a disease means what? The disease which is occurred because of the environment or because of the surrounding environment of that individual. So it includes first one, risk conditions. There are different types of risk conditions in which the main are poverty. If the person is having poverty, then automatically they will get that disease. And poverty, because of the poverty levels, they can't maintain their health, they can't maintain their nutrition, so they will get these diseases. And low education, if they are not educated properly, then they don't know how to maintain sanitation, so like that, because of that also they will get it. And poor housing, that is also one of the reason. If they are not having proper houses, there are chances of getting the disease. And then physiological risk factors. There are different physiological risk factors which will cause these organ failures, like hypertension, genetic factors, etc. So next, behavior risk factors means because of the behavior of the individual, they may get this disease like smoking, alcohol, etc. Psychological risk factors like psychological risk factors like lack of social support. Lack of social support means when the persons are not supporting, when the people around them are not supporting properly, they will get some mental illness. And also social blaming. If the people around them are blaming, then they will get this mental illness. And then hopelessness. Some people, if you think, they are always depressed, they are always depressed, so that is called as hopelessness. Because of that hopelessness also they will get these diseases. And health status. Health status includes ill health, that because of the ill health also they will get the disease. So these are the social causes of a disease, which includes risk conditions, physiological risk factors, behavioral risk factors, and psychological risk factors, and health status. Next, social problems of sickness. What is sickness? First of all, what is sickness? The physical or mental illness is called as sickness. Physical or mental illness is called as sickness. Problems of these sickness includes poverty, immune system, malnutrition, pollution, and incorrect use of antibiotics and antivirals may cause this sickness. Next, nutrition. So what is nutrition? Nutrition is nothing but it is the intake of food for the dietary needs. For the dietary needs of the people, the intake of good food is called as nutrition. The balanced diet, it includes balanced diet. What is balanced diet? Balanced